Tribal Health and Human Services Department of the Confederated Salish and Kootenai Tribes is proud to present Good Medicine, a program dedicated to the wellness of the Flathead Nation. The mission is summarized quite simply: a healthier people, a stronger nation. We will strive to make Good Medicine a reliable source of ideas and information about health issues so that everyone can make informed decisions about their own lifestyle and health care. You will meet health professionals, tribal government and spiritual leaders, and interesting people from the tribal community discussing important health issues that profoundly affect us all.
Hello, this is Good Medicine. I'm your host, Larry Pitts. Today I have a very, very distinguished guest with me. It's Margene Asay. She's been with the Tribal Health probably as long, if not longer than everybody, if I don't want to get into that part. But Margene, would you like to say hello to anybody out in TV land?
Yes, Spina and Nancy, where are you today? They're my co-workers.
All right.
And hi, Grandma Judy.
And Grandma Judy, cool. All right, Margene, you are the Supervisor of Alternative Resource Coordinations Programs. That's a mouthful.
Right.
And to have a title like that, I would imagine your program is a mouthful also. Could you tell us what your program does just a little bit?
Larry, basically what our program with Tribal Health is, our job is to save contract medical care dollars. And by saving contract medical care dollars, we put it back into the system for Tribal Health for those that don't have insurances, don't have Medicare, don't have Medicaid. So our job is to get people on other resources in order to save the Tribal Health dollars.
Mm-hmm. Now, in doing that, I see what you're trying to do, but how does that work? I mean, how do you go out and find it if they're not on a program?
Well, mostly we depend on the people to come to us to get the information out. We work a lot with third-party reimbursement, and by that I mean like Medicare. Mm-hmm. To get on Medicare, you have to be on Social Security. Mm-hmm. We work a lot with the Social Security Administration. Also Medicaid. To get on Medicaid, you're on SSI, Supplemental Security Income. And then other programs of Medicaid would be like the Medicaid through the local offices of public assistance, mm-hmm. which would be Medicaid for SSI, Medicaid for the Pregnant Women's Program, Medicaid for AFDC, lots of Medicaid programs. Mm-hmm. But Medicaid and Medicare is probably our biggest reimbursement for Tribal Health dollars.
Mm-hmm. Well, you know, as I watch the news at night, read the paper in the morning, you keep seeing Medicare, Medicaid, Social Security. I mean, so many changes happening. You must have a staff that's huge.
Actually, Larry, that sounds overwhelming. We have 3 people that work in our program, the Alternate Resource Program. And if I could mention them is, where are you, Spina and Nancy? Nancy Vaughn, she works with the program as a contact rep, as her title is. And Nancy basically does 3 things in her job description. We do a lot of things, but basically is patient travel, the Pregnant Women's Program. And Nancy said if there's any women out there that are pregnant, please contact Nancy or Spina, and mm-hmm. we can get you going on some applications. And Nancy also does the chef cases. Now basically what that is any high-cost case that is over $18,500. Mm-hmm. She completes a special form that's sent in, and we get reimbursed on that. So again, that's saving contract health dollars. Mm-hmm. The second employee that we have is Spina Grant. Now Spina just started working here when our new compact came in, reorganization, October of '95. Spina is in a trainee position for resource coordination trainee. And Nancy has about 20 years plus with her job, mm-hmm. and I have almost 20 years. Mm-hmm. And so we are training Spina to do what we're doing.
Well, we call you guys the old timers.
The old timers, yes, the very old timers.
Right.
In fact, I know Social Security so well that I shouldn't have any trouble when I apply for it.
Cool, that's great. All right. And Spina, you know, in the training program, you guys are teaching her, directing her in the things that she's going to do, so she couldn't have better teachers.
Oh, well, I hope that's what she feels too. She's getting some pretty good training. I wished I had somebody like myself 19 years ago, and I didn't, and so I've had to stumble through it and kind of hit or miss. There is so much going on with the Social Security, the welfare reform, the legislation. As we talk today, there's legislation going on. Our job is to keep up with it. Because people depend on us, and we speak as an advocate for our tribal people. So we're the open gate to Social Security and Medicare and Medicaid, and it's nice when you have a good personal relationship and are able to work well with them. We get the job done quite well, and of course we get a lot of help from the Social Security office and all the other offices that are combined.
Well, you're networking. You know, get back with Nancy just a little bit. I know that she does a lot of things as well as yourself. You stated 3 things here. I would say your other stuff is duties as assigned, I guess, is in your description.
Yes.
And I know Nancy's a new grandma, so she might have a new way to work with for the pregnant women. She's good at that. I've watched you for years, Margene, and you know, sometimes people who work in tribal credit don't get the credit tribal health don't get the credit they deserve. And I know in my past, during a couple of injuries, you were invaluable.
Thank you.
I mean, it was awesome. And so I would, you know, put out the invitation for people to use you guys.
Yes.
That you're there to help the people. Social Security is changing all the time. What is the actual age that you can be eligible for Social Security?
Right now, currently, for full benefits, it's 65 years old. Of course, you have to pay into the system. I tell people what you pay into the system is what you get out of the system. I've got people on Social Security for $200 a month. I have people on Social Security for $1,200 a month. So you can tell the person with the more has paid more into the system. But right now, the current full benefits is age 65. Although you can apply for Social Security at what they call early benefits, early retirement at age 62. And the difference between age 62 and 65, which people always ask me,
That's my next question.
is your next question, is 20%. So it'd be 20% less than what you would if you waited until you were 65. One of the new legislation that came out is anybody that was born after 1938, the full benefit for Social Security retirement is now 67. So us young people like you and I, we have to wait until we're 67 to retire.
Thank you, by the way.
Okay. And so age 62 and 65 will be a reduction in their Social Security benefits.
Do you foresee that in the future of going up even higher, age-wise? I mean,
I hope not. I just hope, and I like to get out in the public. I've taught a couple classes at the college through the Human Services on different aspects of tribal health and social services and Medicaid and Medicare, and how I present it is, the way I look at it right now is I'm working and I'm paying for grandmother and grandpa to be on Social Security. That's how I have to look at it. I just hope when I retire, somebody out there is working too. So they changed the law on the age 65 so as they can keep the money in the program. They say that Social Security's been in the red, but I believe that it'll be there. Social Security was set up never to be a full retirement program. It's only was set up as a supplement, and that's why a lot of other people, like our tribe, we are also paying into our tribal retirement. I believe the BIA never used to pay Social Security, but they're paying it now or have the option. So they have 2 plans, the Social Security and their Bureau retirement. So just hope that it'll be there for a long time.
well, so the money that they're taking out right now truly is a part of your future.
Right.
And I guess I was on the news the other night. It said right now there are 10 or 8 people for each person on Social Security they're putting into it. But by the year 2000, it's going to be down to 3. So we're going to have to become more productive. Reading the questions I want to ask you, how old can the person retire who is a spouse? You know, that the husband or the wife is working and...
Okay, the magic number there is 62.
Okay.
I always have my magic number, 65 and 62, but it's going to be 67, 65, and 62.
Do you bet on those on the lotto?
No, but I should. I don't gamble. I don't gamble, I should.
Okay.
62, you can draw off your spouse's record. Now, when I say a spouse, it could be both husband or wife. Typically, a long time ago, it was always the husband that worked and the wife stayed home. So therefore, when the husband started drawing Social Security, the wife was eligible at age 62. But now it's very common that both husband and wife are working. So when I say a spouse, the husband can draw off of the spouse's record at age 62 or she can draw off of his record at age 62. If you have both in the family that are working, husband and wife, then they're both paying into Social Security. You can only draw off of one record. So when it comes to that point, I will be glad to sit down with anybody, consult with them, go through the steps of what their options are, and figure out what's the best plan for them.
There's sort of a formula there, I would imagine. That
Well, it's a very complex formula that I don't even want to know about. I just know that I can call Social Security and get a ballpark figure of what your retirement benefits are.
and which is the best for you as a couple.
If you were, but they would only pay whatever's higher.
Right.
So if I am going to get paid higher on my number, then of course that's the route I'd go. If I get paid higher on my husband's number as a spouse, then that would be the route to go. You cannot draw off of two records,
right,
two
okay.
Social Security numbers.
What about those people who've been married for years and they all of a sudden they're divorced? Can they draw?
Yes, they do have a role in there now, and it's been there for some time. It's called the divorced spouse. And again, the magic number is 62. So if you're a divorced spouse out there and your ex-husband is on the system, you've been married at least 10 years, you can draw off of his record, and it is not going to hurt his Social Security. It's in addition to.
All right.
If your ex-husband, and I'm using husband again, I'm sorry, it could be your ex-wife, so
Right.
it's either husband or wife.
correct here.
Exactly.
Yes.
If your ex-husband is not on the system, meaning not drawing Social Security, then you need to be married at least 10 years, as I said on the first one, and divorced at least 2 years. Now, that gets a little complicated, and I get a lot of phone calls saying, hey, I was married 3 or 4 times. What do you think? Well, let's get the numbers, and we'll sit down and talk about it. So you could conceivably be married 3 or 4 times and have 3 or 4 ex-husbands out there.
So if you were married to a man or a woman for more than 10 years, you conceivably are eligible to draw from them.
If you're 62 years old and if that person is paid into Social Security.
Right. Okay. Now,
Possibilities.
Yeah, I have a lady who's going to have to get hold of you on
Get a
that.
hold of me, you
Yes,
betcha.
help me with that. Okay, what is a survivor's benefit?
Okay, part of the Social Security system, we touched a little bit about the retirement benefit and the early retirement, and then we touched a little bit on the spouses. We also have survivors benefits that Social Security, and I do have to say that I've worked a lot with people before, during, and after death, which sometimes is not a real fun thing, but you get real close. We're a very close family on the reservation, and we're always helping each other out. But if there is somebody that should die, I usually check to see if the person is insured status, meaning they've paid enough quarters into Social Security, because I'm looking out for the widow. Now, a widow can apply under the husband's record if he's, of course, paid into Social Security. She needs to be 60 years old for a widow. A disabled widow is age 50. We also have survivor benefits for children. We have what they call the student benefits. And if the wage earner mother or father died, or both mother and father died, and there is children that are under the age of 18, and they've paid into Social Security will pay student benefits from up until that child is 18, 19, or graduate from high school, whichever comes first.
Okay.
And then they also have what they call the mother's benefits. So you have a husband that died, and you have a mother that is home with children. So we can pay for the children's benefits, and then also we can pay for the mother's benefits, which will pay the mother up until the child turns 16 years old. And all of these it won't affect each other's income. It's part of Social Security. The wage earner has paid into the system. The wage earner is not here to collect, so therefore we look at the entitlement programs to the survivors. And Social Security does pay well with the survivors, and they process those claims very, very fast. I have to give them a lot of credit on that.
Well, you know, it's sort of nice to hear some positives about the system.
There is a lot of positives.
You know, you've worked with them a lot. I know the student benefit, that's changed from when I was in college.
Yep.
The ages have dropped down dramatically. Some guys I went to college with, as long as they were going to college, they were eligible.
It used to be,
The child benefit used to be, I think, 18, if I remember.
Right, and that dropped.
So things are changing.
Right.
And so, again, I'm going to give you this a little bit of a blast here for the fact that people need to keep in contact with you.
Right.
You know, there is a death in the family, get hold of your program.
Right. If there's any questions, you know, feel free to call us. That's what we're there for. And if we don't know the answer, we'll find out.
Okay, well, then I got it's probably a personal question. You know, my children are adopted, and, you know, I want them to be able to receive the benefits from me if something does happen to me.
Right.
So how about them?
Exactly. Larry, the definition of a child in the eyes of Social Security is a natural-born child, a stepchild. Say I'm married and my husband had a child, so if something happened to me, my husband's child, which would be my stepchild, is eligible for benefits. And then adopted children, just like in your case, Larry. So if something should happen to you, heaven forbid, and I don't even like talking about these things, but we have to be realistic when we talk about survivors' benefits and deaths too. It's real, and it does happen. If something should happen, yes, your children and your wife would have to be 60 years old, and I know she's not 60, but those benefits would be paid to the children.
All right, and how long? And there's no time limit on that. It's from the time that they start. My son is 3 until he'd be 16 then, right?
Well, that's for mother's benefits.
Oh, mother's benefits.
Yeah, so we could get your wife paid mother's benefits, and then your adopted children paid survivor's benefits.
Right.
Up until they're 16, but the survivor's benefits will continue, and your child is how old now?
My son's 3.
3. So he'll be eligible up until he is 18,
right.
19, or graduate from high school, whichever one comes first.
So if you don't want to be too quick.
Right, exactly.
Right, all right. What is SSI? I hear about that. I mean, I hear Social Security, and I hear this thing, SSI. It sounds like Secret Service stuff.
Well, it is kind of secret.
Okay.
But I'll tell you my secret.
All right, thank you. I appreciate that.
No, it's not a secret. SSI is another program that's administered by the Social Security Administration, and it's called Supplemental Security Income. And SSI are for people that are 65 years old, and then they look at their income and their resources. So it's like a low-income program because they have a level of which you can receive before you're eligible or not eligible. For example, a single person, they can have like $2,000 resources. So I tell people, if you're 65 years old and you have no income, please call me. And if they're 65 and they're under resources, I can get them on SSI almost the next day. That's how fast it is.
Wow.
Now, if you're under 65, then you need to be 100% disabled. I tell people I don't make the rules for Social Security. In fact, sometimes I don't even like them, but I know what they are and I know how to follow them. So a disability in the eyes of Social Security is a disability that will last for at least a year or cause death. and with the welfare reform and with the cutbacks and legislation, it just seems like it is getting tougher and tougher and tougher to get people on. But we will continue to work as hard as we can for the people out there.
So they have their pretty much absolutes that you try to finagle yourself within those absolutes for people.
Exactly. And I can sit down and visit with somebody, and I always tell them, I go, I'm going to ask you some questions. I don't even have to know their name. Their social security number is so important, and their birth date. And once I know those two things, and then I start asking questions, have you been married, and how long were you married? And they're looking at me, and I'm thinking about the 10 years we talked about. I'm asking if they have any children. I'm thinking about the children's benefits. Sometimes I tend to get personal, but I always say, I'm going to ask you a question, but I have a good reason for it. And I always tell them, it's really important that if you've paid into the system and if you have some benefits that you're entitled to, it's important that there is somebody that will help you advocate for you.
You need an advocate, and you are a very good one. Now, just so the people understand, you were employed by the tribe, though, so you're only helping tribal members at this point, right?
Well, actually, that's a good question. Larry, right now, my job, I'm employed by the tribe, and my salary is paid by Tribal Health. So I work with all the beneficiaries of Tribal Health Department. So it's not just enrolled tribal members, anybody that is eligible for Tribal Health. And then we get into this on and near regulation, and if we're Indian from our tribe living here, we're eligible for Tribal Health. If I live in Missoula, I'm eligible for Tribal Health. But if you have somebody from another reservation that lives on our reservation, they're eligible for Tribal Health. If that person moves to Missoula, they're not eligible for Tribal Health, only direct care. And that gets very, very confusing. So to answer that question, it's not just tribal members, it's anybody that is eligible for our current Tribal Health.
What about a non-member who was married to a tribal member and that tribal member died? Can you help that person, or?
Well, we get to that point, Larry, and I just, if that happened, you bet, I would be there to help them.
Good.
I've had a lot of people say, can you help me? Are you Indian? Are you descendant? Are you anything? No. And I said, well, technically I can't, because we probably have, Spina, Nancy, and I, a caseload of 500 plus ongoing clients. And it's just amazing the amount of time it takes for one person to get on a disability. I've had people I'm working with on a disability in Spina and Nancy. It's been a year and a half to go through the appeals, the court hearing. One worst case scenario, I was working with a lady that was applying for disability, and she died before I could get her on. I mean, that's just, it happens. So I would love to be able to say we could take care of everybody, but we can't. I've even had people say, can I pay you for your services? Oh, I don't think so. But I always tell people, we have enough knowledge and skills with the three of us. There is no reason that we couldn't give them some advice and get them steered in the right direction. Right, and not take 5 or 6 or 8 hours working on the application.
Is there a limit on how much a person can earn? For Medicare, Social Security, as far as the income that they make, if you're 65 to 69 years of age? Or
oh, okay. You asked me a loaded question, and I'm really in tune to what I'm really focused. You said, is there a limit for somebody on Medicare? And then you said Social Security. That was kind of a double question, but I'll answer that question. But let me talk about Medicare just for a second. Medicare is an insurance program, and what you pay into the system for Social Security, if you're eligible, you're also eligible for Medicare. So if there is somebody out there going to be 65 And if you're not sure if you're eligible for Medicare, please call me. You can apply for Medicare and still be working. So to answer that question, Medicare and Social Security go together, Medicaid and SSI go together.
Okay.
It gets a little confusing, and sometimes I get confused, but we usually have a pretty good handle on it.
And I'm easily confused, so.
But I do have people that are on both Social Security and SSI and Medicare and Medicaid. Now, let's go back to the question I believe you asked me is there an income limit on how much you can earn? If you're drawing Social Security, and we're talking at age 65 for full benefits or age 62 for early benefits, technically you can work, be employed, and still draw Social Security. That's a possibility.
Right.
And that's what I would sit down and talk to you about your options if that's the route you want to go. But if you're 65 to 69, you can earn up to $13,500 a year. If you're under 65, it's $8,640. And I have to read these figures because I can't remember everything off the top of my head. Another question probably would come up, well, what if I earn over this? And then how that works is after you earn over the amounts that I had given you, then you pay back $1 for every 3, and that goes back into the Social Security system.
Okay. Well, Margene, we're starting to wrap down. We got a couple minutes here. You want to say something about Medicaid real quick, and then we'll close this out here, or can you do that in a couple minutes?
Okay. Just Medicaid is a state program, and we work with the SSI. When we get people on SSI, they get on Medicaid, and it's a big reimbursement for our tribal health dollars. Social Security and Medicare go together. I really want to give you some toll-free numbers.
Got it. Let's do that.
Okay, I believe they're going to be up here somewhere. Social Security questions, there's a toll-free number which is a national number. It's 1-800-772-1213. And I believe they're open from 7 in the morning until 9 at night. That's what I understand. So this is across the board. It's anywhere from Chicago to Denver to Albuquerque. The Missoula Social Security number is 1-800-289-5034. And the Kalispell toll-free number is 1-800-573-6102. And then, of course, our number at Tribal Health, which you can get anybody you want at Tribal Health, is 1-800-883, or excuse me.
823.
Oh, I got confused there.
No problem.
I don't call myself. 1-800-823-8228.
Okay. Well, Margene, we're right out of time. I want to invite you back. You've got so much knowledge. We got to cover this. There's other fields I know we want to cover. We talked about that. So I want to thank you again for coming on. For those of you out there, look for us tonight on TV at 6 o'clock, Thursdays at noon. And I want to thank you for your time. Good day.
Good Medicine is your program. We hope you watch this and subsequent programs to stay informed about your health care. And we'd like to hear from you about how we're doing. Please direct any comments or suggestions you have to us. You can reach us at